Welcome to Dental Digital Marketing Discussions. Here at My Social Practice, my name is Jack Hadley with My Social Practice. Here at My Social Practice, we are laser focused all the time on social media marketing. But we understand the importance of all aspects of dental digital marketing and how important a comprehensive approach and strategy is. For that reason, we're bringing in many of dentistry's top marketing thinkers and people who advise the industry to talk about dental digital marketing specifically and how to grow our practices, whether it's a general practice, orthodontic, or other specialty practice, how to use digital marketing to grow our practice. And I'm honored today to have a special guest with us. Hello, Debbie.
Hi, Jack.
Many of you know Debbie Seidel Bittke. She lives in Portland, which has gotten tons of snow in the last week, unusually, yes?
Tons.
And Debbie is here to share with us today three very succinct ideas and concepts that deal with effective dental digital marketing. And so we've spoken and identified three things that she'd like to talk about. But before we do that, let me briefly read her bio. Debbie is an international dental consultant, coach, speaker, and author. She's also the CEO at Dental Hygiene Solutions, powered by Dental Practice Solutions. Debbie's a world-class leader in creating highly profitable hygiene departments and a well-known former clinical assistant professor at USC in Los Angeles and a former hygiene department program director. The publication Dentistry Today has often recognized Debbie as a top dental consultant for the last decade. And I want to add one other little thing that I learned about Debbie recently. Hold on, I want to share my screen, and then she's going to tell us one more little tiny tidbit. Debbie?
Hi, Jack.
Can you see that screen?
I see it.
Now, let me preface this. I live in Utah, and I know a lot about skiing. I've skied a lot, and I know the importance of paying attention to a trail sign when it tells you the difficulty of a ski run. Now, I understand that you are a double diamond ski pro. Is this right? Tell us about it.
Well, I'm not a professional skier, but I have taken a few double diamonds, and you asked me for something unique. So that was the first thing that came to my mind. When I was in college at USC, there were some dental students who were on a ski team, national ski team, and they took me on the double diamonds quite a few times.
Well, those of us who ski know that double diamond is nothing to take lightly if you want to live. Right? So
yeah, I don't do that anymore.
Okay. Well, I wanted to share that real quick because I think it's a fun little tidbit. Okay. All right, let's get right into the meat of what we're here to talk about. So we're going to talk about three ideas, and we're going to do it in rapid fire. In fact, I'm only going to allow us 4 minutes for each of the three ideas. Not 4 minutes for all three, but 4 minutes for each of the three. So we're only going to go for 12 minutes, and we're going to give our audience your best thinking.
Okay. Oh boy. Okay.
All right. You ready?
On.
Are you up for the challenge?
Okay.
All right, good. And I'm going to actually set a little timer when we start talking, and we're going to quit right at 4 minutes.
Oh my God.
Okay. All right. So the first idea that you wanted to talk about a little bit is the ways that social media helps your patients find you, or helps new patients find you, rather than you going out and trying to find new patients, and some of the success that you've had with this idea. So tell us a little bit more about this, Debbie.
So Jack, one of the things back in the economic decline, my phone was ringing off the hook with doctors asking me, help me find new patients. And I think that, at that point in time, we didn't have a lot of social media that we knew about back in 2008 and 2007. Facebook was just coming around, and I don't even know if we heard of Twitter. However, I would try to help them to reactivate their patients, because most of you listening to this podcast have there's a 90% opportunity for you to just reactivate your patients, and then growing your practice might be 10% of that is growing new patient numbers. And how to find them In today's world, we don't want to go find. They're asking me, Debbie, how do I find new patients?
Yeah.
And let's flip that into how do they find you? And what I've learned is that my social practice has the keys to unlock the door for patients to find you.
Well, that is a fun concept, and I can tell you've spoken to a couple people on our team to know that that's kind of a big focus around here. And it's I like the fact that you wanted to talk about this because it's a kind of an unusual concept. Most practices don't think that way.
No.
We're kind of programmed to think we got to go out and find new patients.
Oh, yeah.
And it's kind of a different way to think about it. So in some of the practices that you've either met with or consulted with, have you seen ways that they've been good in doing that? Any particular ways?
Yes. So I'm really big on tooth whitening because when you ask anybody, what is it that you want to change about your smile? The majority of your patients are going to say, I want whiter teeth. And so I have been side by side with our clients, seeing them put those Facebook ads out there, put that out there to the people to see that they offer free whitening. So if you can drive people through social media, different ways that people are out there on the internet, if you can get them to see that you offer free whitening, I think it's a great opportunity to open your door very easily for those patients to find you.
Yeah, yeah. And you mentioned part of finding new patients is, of course, getting our existing patients to help spread the word for us. Have you seen any specific ideas where practices have been good at empowering patients to help spread the word about whitening?
Well, just them getting their teeth whitened. So right now, a lot of my clients have a Valentine's Day special running, and we have a special formula that we put into place. And so when those people that are their patients have a beautiful white smile very quickly, people notice it.
Yeah.
It's one thing that people are really looking at, and the general public might not realize it, but people are looking at your teeth.
Yeah, that's really true. And I think the opportunity to do that in a non-pushy, I mean, it's just, you're not trying to sell dentistry or sell whitening. You're just talking about the result. And I think when you talk about the result, it's easy for your patients to help spread the word.
You know, when they're reviewing the medical history, which every team member should do when they're seating the patient before whatever procedure is going to be done, if you can ask each patient, what is one thing that we can do for you today to make your smile better than ever? What do you think that number one answer is, Jack?
I'm guessing it's have a wider smile.
Yeah, I want my teeth to be whiter. I mean, if you just ask that simple question, you'll have so many more people saying, I want whiter teeth,
Yeah.
which leads to other services. And then in the
Hold on. That was our 4-minute timer. So
okay, I'll
finish your thought. Finish your thought. All right, we're done with that. See,
Okay.
4 minutes. That's not very long.
Nope.
But it makes us try to be thoughtful and succinct, right?
Yeah, exactly.
Okay. All right. Idea number 2 that you submitted that you want to talk about. You wanted to talk a little bit about the use of images, photography, maybe video, any type of images, because that's how many people really respond, is visually. So set this up for us. What are your thoughts about that?
So what I've learned over the years is that if I have a picture, and for example, I tested this out, and if it's okay, I'll mention your team. We were, I got to know the people at my social practice. And is it okay if I mention somebody in your office was helping me? Well, Alicia really helped me to dial in a Facebook ad that we were running for one of our live CE events. And I wanted to put a picture of, let's say, the hotel and the beautiful atrium area. And really what Alicia taught me was that if we have that picture portray me speaking, not only does Facebook let more people see it, but more people want to see it because it's engaging them in exactly what we want them to do.
Yeah. I think it makes a big difference. And I know studies shown, and I read them all the time in preparation for the class, the social media class I teach at the university. Study after study shows that people respond much more quickly and much more readily to imagery than they do to text. And so while some subjects don't lend themselves well to imagery or to photographs, many do if you just kind of think that way. So
Yes.
what kind of images have you found in your, as you've been consulting with practices? Are there some specific images that seem to do a lot better than others, or what's been your experience?
Well, I think for whitening, if you're going to run an ad or try to attract people for whitening, one thing that's worked really well is a bride and groom smiling.
Uh,
You know, people love to see the bride and groom, but then when they have beautiful white teeth, it's the next level of success for you as the doctor.
yeah, yeah. What about imagery that comes from team members? Have you seen examples of things that maybe team members do in the practice that maybe don't show patients, but kind of talk about the culture of the practice or the things that the maybe team members do together, or images like that?
So I haven't seen what our team members have posted on social media, but what I did find that was fun is at our dental conference, we had some team members and we caught a great shot of them having fun at our event over the weekend. So I really like that, and I want to put that in some of our new marketing materials, is that the team was just cracking up and they were having
Okay.
fun in our photo booth.
That's great. Now tell us, you were the keynote speaker at an event. Was it just this last weekend
Yes, on
did you say?
Friday in Los Alamitos. So I'm doing about quarterly. I'm going from Oregon and California and doing some 6 live CE events. So they come, we feed them a lot of food.
Good.
We have a lot of prizes. We gave out a lot of Starbucks cards, and we gave out some other prizes. One of them worth $1,200, some coaching from me, and they
That's
got
great.
CEs, and they actually had a plan that they put into place for their success blueprint in 2017.
That's great. Just so our viewers know, at the end of our visit, I am going to give you all of Debbie's contact information. She does a lot of speaking, and it's a good connection for you to have. So we'll make sure that we have Debbie's contact information for you
Oh,
in just a
thank
minute.
you.
So,
Yeah.
all right. So let's talk. That's our time is down to 10 seconds. So
Oh,
we are perfect. All
we
right.
approved, Jack. We're
We
getting
did it.
better.
All right. Last idea. Number 3. You mentioned a concept to me that
Oh,
on its surface seems like a no-brainer. Like, of course we would do that. But I know from working with a lot of practices that it isn't that easy. You really have to consciously force yourself to think this way. And the idea is that you should think about the things that your ideal patient wants and would want to talk about and would have interest in. And then talk about the things that that ideal patient has interest in rather than always talking about yourself. So tell us a little bit what you're thinking about that, and why that was an important topic you wanted to talk about.
so we do this thing with our teams. We teach them to have and we started out with a 2-minute challenge.
Okay.
And it's in 2 minutes, each team member. So usually it's one of the dental auxiliaries. It could be the front office person. And especially it's important with the back office assistant and hygienist that we challenge them to find out within 2 minutes something very special about that patient and then share it with doctor. And the reason why we do that is because doctors are so focused on their clinical dentistry. And then sometimes we tend to forget about the patient. So if the hygienist or the dental assistant can find something out, and one of the first time that I did a role play about this, it ended up that the doctor's daughter was right at that moment in labor having his first grandson.
Oh my gosh.
So it was kind of interesting how I was trying to teach this to the team, and what we discovered was this, So, and there's always something that your patient, Jack, there's something today that is going on with you. And you were focused on me, but you found out something that's going on with me today that could kind of be a little stressful.
Yeah.
There's always something going on with each of us each day. And I feel like if we can find out what that is, that's important to that patient. And it becomes that patient's like, oh my gosh, these people really care about me, and I'm not just another mouth to them.
I think that is a wonderful concept to teach. And it sounds like you teach that often to the practices you're consulting with, yes?
I love it. And we do a lot of role playing, and it ends up being a lot of fun. Like I told you, the doctor was like, what, are you psychic or something? It kind of freaked him out that, I was using an example of maybe he's having a grandson, and actually he was having a grandson. His daughter was in labor, but it ends up being a lot. And they said, oh my gosh, our doctor, because that happened with him, coincidentally, he was so interested in now participating in this challenge, and the team was having so much more fun during their day at the office.
That's so great. And what's so funny is when you think about that, it seems so simple. And yet, if we don't consciously train our team and kind of keep it top of mind, we get so busy in our practices that it just falls by the wayside. And the way that, what's neat is the way that ties to digital marketing and growing a practice is that when people have, you could have been the same kind and inquisitive person prior to digital marketing, but today, when you treat patients that way and you look at it as part of growing your practice, that word spreads in viral ways through digital marketing. So we've always had the opportunity to be kind and interested, but it's especially important today with digital marketing just because of the way that kind of word can spread, don't you think?
Oh yeah, absolutely. If patients know how much you care about them, they know they know that you're such a good dentist. That's how they're judging us. They don't know if we're a good clinician. They really don't know.
That's right. Yeah, so much is based on the experience and not necessarily on the clinical skills, although clinical skills are absolutely important. But from the patient's perspective, yeah, they don't know that. They just know the experience they have a lot of the time.
Oh, yeah.
Well, those are great ideas. And you are perfect on timing. I'm looking at our little clock here, and boy, it couldn't have been closer. 3:58. So thank you.
You're
welcome. All right. So before I let you go, a couple quick things we got to do. Let me get my notes here. First of all, you agreed.
What did I agree to?
You agreed to participate in our current events, pop culture, useless trivia quiz. In conclusion, it only takes a minute or two. And I'm going to ask you 5 questions. And as soon as you answer 3 of them correctly, you win.
Oh, gosh. Okay.
Here's the bad news. You don't win anything because you have identified a practice that you are playing for doing this quiz. And that practice is, let me find it because I can't remember for sure.
Well, Jack, while you're finding it, I just want the listeners to know that this is useless. If in case I get the useless questions wrong. Oh, here they are. You're going to make them world famous.
Loftus Family Dental. Looks like they have 3 practices in Idaho. Is that right?
Yes, Northern Idaho.
Beautiful. And this is a client of yours?
Yes.
Yeah, well, you are playing on their behalf today.
Oh, gosh. I hope it can make them happy.
The pressure's on. Okay, you ready to play?
Okay.
Question number 1. Today, Tuesday, the 17th of January, 2017, is a legendary actress named Betty White. It's her birthday today.
Okay.
I'm going to give you 3 ages, and I want you to see if you can pick how old she is. She is either 81, 95, or 101.
95.
You are correct.
I love Betty White.
I love Betty White too. And it's funny, it happens to be her birthday today. And since you got that correct, ready?
Okay.
1 out of 1. All right, ready? Number 2. This week's presidential inauguration will take place in which major U.S. city?
Washington, D.C.
You are, oh wait, you are correct. Number 3. Last week, what college football team did Clemson defeat to win the national championship?
Oh, no!
You want to guess?
Is it the Falcons?
No, that is incorrect.
I'm not a football fan. You should have asked me a tennis question.
Okay, it was Alabama.
Oh, gosh, okay.
All right, you're 2 for 3.
Loftus Family Dental.
You are 2 for 3. You got 2 more to go.
Oh, I do? Okay,
You
good.
only have to get one of these 2 correct.
Oh, okay, good.
Ready?
Okay.
What fictional city is the home of Batman?
Oh, Gotham City.
You are absolutely correct.
Redeem myself.
You are the winner.
Oh, my husband's going to be so embarrassed because he loves football and I'm not a football person.
And congratulations to Loftus Dental up in Idaho. And My Social Practice is going to treat them to lunch.
Wow.
That sound fun?
That is great. I'll let them know.
Okay, we'll be in contact with them. You gave me some contact information, and we'll get a hold of them and take them to lunch.
That's going to be an expensive lunch, Jack, because they have like 30 employees.
Oh, no.
Oops.
Looks like we're going to have McDonald's.
I appreciate it.
All right. Last thing, I want to put on screen one more. I want to share my screen one more time, and I want to make sure that we have your that everybody has your contact information. So let me put this up on screen. This is Debbie's company name, Dental Hygiene Solutions, powered by Dental Practice Solutions. There's her phone number. Her web address is dentalpracticesolutions.com. And there's her email address, debbie@dentalpracticesolutions.com. So get a hold of her if you want to talk about some more of these concepts that we talked about today or learn more about how she helps practices. She's an awesome resource, and I've been grateful to visit with you, Debbie.
It's been fun, Jack.
Yeah, it's been fun. And Debbie, one more little bit of trivia. Debbie is our guinea pig with this format. And thank you so much for letting us try this out on you, this new little format that we're doing for these little interviews.
Jack, thank you for making me number 1 today.
You are number 1. Hey, also, just one other quick thought for those of you who don't know. Part of the reason we're doing dental digital marketing discussions is in preparation for the Dental Digital Marketing Conference. 3 or 4 years ago, we came up with this idea to sponsor a no-frills conference that's focused exclusively for 2 days on nothing but dental digital marketing. And let me show you real quick just what this conference, a little bit of what it's about, and I'll give you all the URL in case you want to check it out. The conference was originated in Dallas. We had it the first 2 years in Dallas. We're moving it to Las Vegas this year at the end of April at the Red Rock Casino and Hotel there in Vegas. When you go to the website, there's a little video that shows last year's event, some of the things we did. You can look at the schedule. We've invited many of the top speakers in digital marketing that are exclusive to dentistry that are going to speak. And you can kind of get an idea whether or not this is a good fit for your practice and consider whether or not you'd want to attend. You can learn more at dentalmarketingconference.com. That's dentalmarketingconference.com. And so with that in mind, I'm going to stop sharing that screen and we'll say au revoir. Au revoir. Thanks again, Debbie. And we look forward to talking the next time. And I look forward to seeing all of you in the next Dental Digital Marketing discussion.